Welcome back to the channel after the weekend. Hope you had a good weekend. So last week we have started with lichen planus and we have seen the different form, the reticular form, plaque form, erosive form, and we have also concluded the differential diagnosis. Okay, we'll be continuing today. Okay, let's start. Now coming to diagnostic workup. Diagnosis is made from mucosal biopsy, skin biopsy. Okay, both the biopsies are important, mucosal biopsy and skin biopsy. Avoid biopsy of an ulcerated area. Why? Because ulcerated areas will be distorted by epithelial loss and secondary non-specific inflammation. It is best to biopsy a red or white area and include some surrounding normal appearing tissue. तो ये basic rule है कि थोड़ा normal tissue भी लेना है surrounding. Okay. The use of direct immunofluorescence is not specifically required to diagnose lichen planus because it is a T-cell mediated disease in which there are no autoantibodies or other specific marker to identify. तो इसमें डायरेक्ट इम्यूनोफ्लोरेसेंस का कोई रोल नहीं होता है बिकॉज इट इज़ नॉट बी सेल, इट इज़ टी सेल मेडिएटेड डिजीज़ और इसमें ऑटो एंटीबॉडीज़ नहीं बनती. Okay, now coming to histopathology, it involves a cell-mediated immune reaction that damages the epithelial basal cells. We have seen that. Langerhans cells increased in number in lichen planus. तो हिस्टोलॉजिकली हम लोग को लैंगरहैंस सेल्स ज़्यादा दिखेंगे इन lichen planus. Okay, these are antigen presenting cells to which T cell response forms a banded infiltrate subjacent to the epithelium. तो ये Langerhans cells जो है वो antigen presenting cells है, ठीक है, to which T cell respond. It forms a banded infiltrate subjacent to the epithelium. अब इस infiltrate में क्या होता है? The infiltrate is typically well demarcated inferiorly, but it invades the epithelium, effacing the epithelial connective tissue junction. So जो ये infiltrate होता है वो epithelial connective tissue junction में invade कर देता है. The T cells are cytotoxic to the basal cells, which undergo वैक्यूलेशन एंड लिक्विफिकेशन. तो बेसल सेल का क्या हो जाता है? वैक्यूलेशन एंड लिक्विफिकेशन. डिजेनरेशन सेकेंडरी टू लॉस ऑफ बेसल सेल्स lead to and which will lead to release of melanin into the connective tissue. Degeneration होगा, ठीक है, liquefaction, degeneration. Now sorry for that. Secondary to loss of basal cells, अब जैसे ही बेसल सेल का लॉस होगा मेलानिन में बी रिलीज इनटू द कनेक्टिव टिश्यू. It is picked up by macrophages and these macrophages are known as now melanophages because इसमें मेलानिन आ गया, known as melanin incontinence. This process is responsible for the frequent violaceous color that may be associated with lichen planus. तो ये जो प्रोसेस है लॉस ऑफ बेसल सेल्स, मेलानिन रिलीज़ होता है, मैक्रोफेज उसको पिक करते हैं, फिर वो मेलानोफेजेस बन जाते हैं. इसकी वजह से जो फ्रीक्वेंट विलोशियस कलर होता है lichen planus का होता है. ओके, नाउ कमिंग, the reticules lose their well-defined architecture and often appear to melt into the fibrous tissue. इसमें ऐसा टर्म दिया है कि इट मेल्ट इनटू द, ऐसा अपीयर होता है कि वो मेल्ट हो रहा है फाइब्रस टिश्यू में. नाउ hyperkeratosis and or hyperparakeratosis is also seen along with the varying degree of acanthosis and or atrophy. Round to oval eosinophil cells are found in lower epithelium or lamina propria. These represent necrotic epithelial cells and have been called as cavate bodies, colloid bodies or apoptotic cells. Apoptotic cells क्या होते हैं? जो खुद ही खुद को खा जाते हैं, ठीक है, apoptosis. So cavate bodies, colloid bodies और apoptotic cells. The histological features of lichen planus vary according to the age of the lesion. जितना जैसे जैसे एडवांस होगा उसका जो histological features है वो चेंज होता जाएगा. Lichen planus does not produce a single definitive histologic picture, and depending on the stage, the changes may be non-specific. Okay, that's all for today's class. We'll be continuing this in the next class. Till then, like, share, subscribe, and comment. Bye.